Hi, my name is Susan Elliott, and I am a nurse practitioner at St. Louis University School of Medicine. I work in the Division of Geriatric Medicine. The talk today is on CNA care, why it's most important. A disclosure, my university does receive funding through HRSA, which is a government agency, in the form of a grant, so it's money that was awarded to us as a geriatric workforce enhancement program. So part of my salary is funded by this grant. The objectives today are to understand how hydration, nutrition, skin integrity, and mobility are all interconnected and how they relate to resident health. Apply the concepts of an age-friendly health system, which is called the 4Ms, through daily care provided by CNAs, and then understanding nursing home quality measures as they relate to the resources. So here you see the model of care. It's called the age-friendly care system and the 4Ms. The M's are what matters: medication, mentation, and mobility. In our context, what matters could be anything because the nursing home is like a home-like environment. Medication is really, we're trying to optimize the good meds and limit anything that could be harmful. Mentation could refer to dementia, depression, anxiety, or delirium, like when someone is confused when they have a bad infection. Mobility, how well a person is moving and how able they are to participate in their activities of daily living. So we'll see how important CNA care is actually to providing the best age-friendly care we can in nursing homes and long-term care facilities. Simply asking about what matters improves physical and mental health, according to a study in 2021. So CNAs see and understand the resident more frequently and more completely than any other provider. They're there during the shower, they're there during dressing, and they're able to see if a person can roll over and help get dressed. Are they thinking right? So we're able to really detect changes in status, and CNAs are the first line of defense for providing quality and safe care in nursing homes. An evidence review shows that CNAs are key to resident quality of life and improve patient-centered care. They improve communication, physical function, nutrition, and participate in meaningful activities. So really, CNAs are essential in the most important parts of life. So what is a facility 5-star rating, and what is CMS? CMS stands for Centers for Medicare and Medicaid Services. CMS regulates the nursing homes who receive the reimbursement for residents, and there's a website that the government puts out called Care Compare, where anybody can go out and compare the different nursing homes, long-term care facilities, to see what their star ratings are, and they can make an informed decision on where they want to put their loved one. 1 in 5 residents have malnutrition. So when we look at CMS and the guidelines, nutritional care, early identification of a resident's need for feeding assistance is absolutely crucial. A resident might need a restricted diet to maintain nutrition, but absolutely cannot be made to eat one against their will. When they're made to eat diets that they don't want, they often can lose weight. So failure to incorporate resident food preferences, which is their right, their resident right, which results in actual weight loss, is considered harm. Nutritional interventions include liberalizing a diet, and that means making it from most restricted to the minimally restricted diet that they can handle and that will eat. So food needs to be palatable, so it has to taste good, it needs to look good, be attractive, it needs to be nutritious. There really needs to be a flexible dining environment to promote intake. So what about the people that don't eat on time? We need to be supporting them functionally. Do they need their glasses, their hearing aids? Are they physically able to lift up the utensils? Do they have dementia and they're wandering all over the place and won't eat? Do they need the finger foods? What about dentures? And then most importantly, really, food and hydration need to be within reach, so that it has to be accessible. We want to provide nourishing supplements and snacks between meals So I'll leave you with a thought here at the bottom to think about what you might think is the best supplement in a nursing home. We'll talk about that here in a minute. Proper hydration is a critical aspect of nutrition. So drinks have to be accessible within hand's reach, not across the room or on a bedside table that's moved too far away. Alternatives include broth, gelatin, popsicles, and ice cream. So in the eyes of CMS, dehydration is avoidable unless proven otherwise. Since I work in long-term care, I know often people refuse to drink. You can hold it up to their lips and they squeeze their lips as tight as they can. They won't drink. So really charting needs to be occurring that a resident is refusing, because if it's not charted, then your actions aren't recognized. Rarely is dehydration from neglect in the nursing home. More than 1 in 3 nursing home residents are likely dehydrated. Inadequate hydration increases chances of UTIs, pressure ulcers, skin infections, and confusion. The evidence shows that older adults can have poor thirst, and when they're dehydrated, they have falls, little energy, and worsening dementia. Offer drinks through social activity, so anytime people are gathering, whether it's a routine activity or a special organized activity, and then provide verbal and visual cues. And then on the table here, you can see the chocolate milk, and that's the most nutritious and best hydrating type of supplement we can do in a nursing home. So it provides both calories and it's hydrating. So we really like our chocolate milk. More than 1 in 3 nursing home residents are at risk for weight loss. Unintentional weight loss in older adults is associated with poor nutrition, muscle loss, decreased physical function, and death. So weight loss and poor nutrition are considered avoidable unless a facility can prove otherwise. So back to charting, that maybe a resident was offered food but they didn't want to eat it, or they pushed it away, or all the things that you did to try to get them to eat, including preferences. New and worsened pressure ulcer rates are monitored by nursing home regulators and are part of a facility's quality ranking. So we have to maintain or improve nutrition in people that have pressure ulcers. If we're not doing that, then we're not going by the guidelines. We know, the people that work in long-term care know that sometimes it's hard to get someone to eat, much less eat more than they were before. But it's something we really need to be trying. Frequent position changes and offloading pressure are other interventions. We use special equipment like the boots and the pressure reducing cushions and mattresses. Frequent procedures are often needed for people with pressure ulcers and wounds, sometimes expensive wound care and antibiotics, going out to the wound care clinic. Ultimately, pressure ulcers cost the United States more than $26 billion annually. What is sarcopenia? Sarcopenia is low muscle mass and low strength, so it results in decreased physical function. Sarcopenia is present in 84% of nursing home residents. So think about that, almost 9 out of 10. Nursing home regulators monitor physical function, specifically decreased activities of daily living and independent movement, which can contribute to the facility's quality score. So maintaining function is a huge part of providing age-friendly care. And then that's the mobility for one of the 4 M's. So we can see right now how important CNAs are to keeping a person up and moving and active in life. So lives can be saved through early detection. So you're the first line of defense against mental status changes, dehydration, weight loss, nutritional deficiencies, decreased mobility, wound development, or progression. So these are very important factors. What can you do? If you see something, say something. Use the stop and watch tool. It's an evidence-based tool. You can see here on the left that the S stands for they seem different than usual, talks or communicates less, overall needs more help, pain, they ate less, no bowel movement, drinking less, weight changes. So are they agitated? Are they tired? Is their skin changing in some way? And do they need more help with their activities of daily living? If any of these things are occurring, then we have to let someone know so that they can be fixed. In fact, when we do use the stop and watch tool, the evidence shows us that it can prevent strokes, heart attacks, dangerous infections, organ failure, and countless other life-threatening illnesses. CNAs are part of the interdisciplinary team, and they should participate in care planning and are positioned to promote age-friendly healthcare. So there was 2 studies that looked at really using CNAs as their model of care to improve age-friendly health to residents and long-term care facilities. So what can you do to address the 4 M's and really handle what matters to a resident? Well, ask them what their preferences are. Looking at their mentation, so how they're thinking. Are they different from their baseline? Are they confused, mad, sad, worried? Medications. So you might think that medications don't fall under, what you're supposed to do, but they really do, because you see how they act after they've had their meds. Are they different? Are they overly sleepy? Are they unsteady, having falls? Mobility, are they less able to turn, transfer, propel, walk, or participate in their activities of daily living? A word about agency staff. So agency staff don't know the residents, they can't detect the changes in status or communicate with families well. They do not understand the EHR or the protocols we use in the facility, and sometimes they don't care because they're off to their next assignment. In fact, in 2009, even before the pandemic, it was identified that facilities that used 25% more of agency staff had decreased CMS quality measures. So 11 of the 15 measures were better in homes that used no agency compared to the ones that used 25% or more. Back to the star rating. So keeping the star rating is high because it can literally make a place worth working in, and that helps keep staff that are quality in the place. So what happens when you have a low rating? Well, low ratings equal less reimbursement. So fewer Medicare patients are being accepted to the facility because they're going to places with higher star ratings. This leads to the facility having a lower budget. They can't hire permanent staff because they simply don't have the money. They're bleeding money by paying agency staff. And then they have a higher staff turnover rate because of burnout, because the regular people that are stuck are like, wow, I really have to help these agency people make it through their shifts. So that happens more and more, so the rate of agency staff use goes up, not down, and then that further declines in the CMS star rating. So it's really a vicious cycle. So we have to start at the bottom and make sure that we do the 4 M's. We put an emphasis on mobility and mentation and hit on what matters to a person, and understand that medications can affect the other 3. So that's the end of the presentation. If you have any questions, you're welcome to reach out to our department at the Aging Successfully Gateway Education Center. We have resources, happy to share with everybody. And then these are my references. And that's it. I'm very happy to have presented.